The Bipolar Disorder Survival Guide: What You and Your Family Need to Know. By David J. Miklowitz, Ph.D. Narrated by Kris Koscheski. Copyright 2011 by the Guilford Press. This unabridged audiobook is published by arrangement with Guilford Publications Incorporated and was produced in the year 2013 by Tantor Media Incorporated, which holds the copyright thereto. Publisher's note: this audiobook is packaged with bonus material, which has been included on the first audio and MP3 CD. If you downloaded this audiobook in a digital format, please visit our website at www.tantor.com and type the Bipolar Disorder Survival Guide into the search box. Follow the link on the book's page, then click on PDF Extra 1. When prompted, enter the access code Mood Cycles to access the bonus material. Preface. I first became interested in bipolar disorder in 1982, when as a pre-doctoral psychology intern at the University of California, Los Angeles, UCLA, Medical Center, I supervised a bipolar support group with a fellow intern. The assignment was a challenge, but I was immediately struck by how the members of the group, men and women, ranging in age from 19 to 50, had discovered, quite independently, how to deal with their illness. They had learned to ask for medical and social support when the early signs of recurrences first appeared, to rely on their significant others for emotional support, and to separate themselves from the disorder and fight its stigma. All of them understood that leading fulfilling lives required more than just taking medications. The experience inspired me to choose a PhD dissertation on this disorder, specifically about family relationships among late adolescents and young adults who were recently out of the hospital. In the 25-plus years since, I have cared for or supervised the care of several hundred people with bipolar disorder, both young and old, and their families in the context of my research studies and clinical practice. People have come to my office in a variety of clinical states, each person with his or her own unique expression of the disorder and unique beliefs about how it should be treated, the factors in his or her genetic, biological, or family background that caused it, and what it meant for the future. Many have had a love-hate relationship with the illness. They have cherished the intensity of the emotional experiences that mania provides, but have detested the low periods, the disorder's unpredictability, and the emotional, practical, and financial damage done to their lives. My long-term collaboration, 1979 to 1997, with the late Michael Goldstein, Ph.D. of UCLA, resulted in the development of family-focused therapy, FFT, an intervention that assists people with the disorder and their family members in coping during the periods after an illness episode. My experimental studies at the University of Colorado and those with my UCLA colleagues have shown that people who receive FFT and medications have lower rates of relapse and less severe symptoms than people who receive individual supportive care and medications. Their improvements can be observed for up to 2 years after they begin family treatment. Our most recent work has shown that teens with bipolar disorder benefit from FFT and medications as well, in terms of better recoveries from episodes of illness. These studies, funded by the National Institute of Mental Health and the National Alliance for Research on Schizophrenia and Depression, have included more than 400 people. The participants have varied in age, ethnicity, race, and socioeconomic status. They range from people experiencing their first manic or depressive episode to those who have been ill for most of their lives, from people for whom the disorder poses only occasional life problems to those who are chronically in and out of hospitals, and people in a wide variety of living situations and family contexts. I wrote this book to respond to a need voiced by virtually everyone with whom I have worked, along with their family members. People with the disorder wish for more understanding from relatives, friends, and coworkers. Their family members, in turn, want to know how best to help their bipolar relative without becoming angry, controlling, or overprotective. Both ask the core question this book attempts to answer: how can people with the disorder achieve better mood stability and lead more fulfilling lives while taking medications and dealing with the realities the illness imposes? The second edition of this book reflects my experiences and those of others in working with people with bipolar disorders over the past decade, as well as what the field has learned from the latest research. Much has changed since the first edition, in part because of large-scale studies of pharmacological and psychotherapeutic strategies for people with bipolar depression or mania. For example, the first edition barely mentioned lamotrigine or quetiapine, and instead emphasized drugs like carbamazepine, some of which have fallen out of favor. More and more psychiatrists are favoring atypical antipsychotic medications instead of, or in conjunction with, mood stabilizers. There are new findings on the use of antidepressants. And perhaps most important, there is now considerable evidence regarding the role of psychotherapy as an adjunct to medications for people with bipolar disorder. This revised edition offers a new chapter on issues for women with bipolar disorder, Chapter 12. We know much more than we used to about the needs of women with the illness, how to manage mood-stabilizing medications when pregnant, during the postpartum, or during the perimenopausal period, how to cope with irregular menstrual cycles, weight gain, or hormone abnormalities, and about the side effects that affect women more than men. As with other areas of medicine and other illnesses, women need and deserve to be recognized as different from men so that they can have the best chance of managing their symptoms and leading the lives they want to live. It is my strong belief that people who do best with the disorder are those who have learned to recognize triggers for their mood cycles and how to minimize the impact of these triggers. They are people who stay close to their recommended medication regimens and have good relationships with their physicians. They have regular therapists or go to support groups. They have learned as much as they can about the illness, go to conferences where the latest findings about the disorder are presented, talk with others who have the illness, and read books and articles concerning the latest treatments. They have learned to accept the disorder, but do not unnecessarily limit their personal goals because of it. At that bipolar support group years ago, I was impressed by the members' ability and willingness to take care of each other as well as themselves. One group member regularly made trips to the local hospital inpatient unit to tell patients with the disorder about the advantages of obtaining medical and psychosocial treatment at the UCLA Mood Disorders Clinic. When a member of the group started to cycle into an episode, others were quickly able to recognize the early warning signs and offer assistance. Members were often blunt with each other, but would say things that needed to be said. I'd like to think of this book as performing the same function as that support group. It is my sincere hope that after listening to it, you will feel less alone in your struggles, realize that there are effective treatments available, and have strategies to prevent mood swings from ruining your life. I hope this book will tell you the things that need to be said, and that you'll use them to your benefit, even if you don't always want to hear them. Most of all, I hope you and your family members will become convinced that you can lead a full life and achieve many of your personal goals despite having the disorder. Part 1. The Experience and Diagnosis of Bipolar Disorder. 1. How this book can help you survive and thrive. Why do you need this book? To understand the symptoms, diagnosis, and cause of your bipolar disorder. To learn about effective medical and psychological treatments. To learn self-management techniques to help you deal with mood cycles. To improve your functioning in family and work settings. Martha, 34, ended up in the hospital after storming out of the house, in which she lived with her husband and 2 school-aged children, and spending a disastrous night in a town over 2 hours away. Her problems, however, had started about 2 weeks earlier, when she became unusually irritable with her husband, Eric, slamming about the house, as he described it, and becoming easily provoked by the minor infractions of their children. She then began to sleep less and less, and was increasingly preoccupied with many ideas for a new .com business she planned to start. Despite this intense focus, Martha seemed very easily distracted. She also began speaking very rapidly. Her problems came to a head when she left the house in a fury shortly after dinner one night and impulsively took a bus to a gambling casino about 100 miles away. By her account,
Sample complete. Ready to continue?